There's nothing more frustrating as a healthcare provider when someone needs something that you can't give them.
It's a frustration felt regularly within the emergency room she oversees. WakeMed predicts it will see 4,300 more patients for mental health in its emergency departments this year than in 2019. Mental health related needs are growing, but the beds aren't there to meet it.
So they come to us in crisis. We say, okay, you need inpatient psychiatric care, like you're to that level, but we just don't have access to that level of care.
Across the state, patients are waiting an average of 12 days for a referral from an emergency room to a state psychiatric hospital.
Someone came in with cardiac needs and we said, wait 2, 3, 4 days, that wouldn't be okay. But that has become our reality with mental health care.
She said WakeMed's proposal to add 150 beds to the area is only a start. Data shows North Carolina already has about half the number of recommended psych beds. The I-Team found more than half of the counties reported having no psych beds in their general hospitals, and less than 10 meet the recommended number. This leaves people waiting, driving hours for care, or simply not pursuing help.
Yeah, I would say that the situation is dire and that we've been at an emergency level for some time. COVID has just exacerbated the already broken system.
The North Carolina Hospital Association sent a letter to state leaders calling out the behavioral health emergency and demanding action. A year later, they've received no response. While more beds are needed, the state also needs workers to staff them and patients to afford them.
Hospitals are building capacity, they're trying to meet the need, and we can't do it in a silo. We want to be part of the solution here, and the solution is going to be more than just hospitals. It's going to have to be all parts of the system working together to make the behavioral health care system accessible for everyone who needs it.
Some of those solutions including increasing resources for patients before they reach a crisis and decreasing the number of uninsured patients by expanding Medicaid. And as for what comes next for this proposal for a new mental health hospital here in Wake County, well, WakeMed is still waiting on approval from the state. That is likely to take at least a few months. If it is approved, the hospital won't open until at least 2027. For the I-Team, Samantha Coomer, ABC 11 Eyewitness News.